Compliance basically has two meanings. One is more physical meaning and another one is just merely a mathematical one. Let's just first understand the physical meaning of compliance. To really understand the physical meaning of compliance, we must learn it with an example. So, I'm having a pencil and a rubber band. Now, let me ask you a very famous question. Which is more elastic, a pencil or a rubber band? Let's think about it. So, the real answer to this question is that pencil is actually more elastic. Yes, the pencil is more elastic than a rubber band. Because the elasticity is not what we define as how easily stretchable it is. But the elasticity is defined as how easily not to stretch the object is. Elasticity is defined as the potential of that object to oppose being getting stretched. And this pencil does it so. Because it is not very easy to stretch this pencil up. That's why this pencil is more elastic as compared to the rubber band. Let's try stretching this pencil up. So when you hold the pencil, try to stretch it up, it doesn't get stretched too much easily. So it is very hard to stretch it up. That's why this pencil has more elasticity. That is the real meaning of elasticity. You should not confuse it with another meanings. Right? Stretch up the pencil, it doesn't get stretched. It is hard to stretch up, it has more elasticity. It is so simple. Right? Let's talk about the rubber band. You take the rubber band, you stretch it up, it easily gets stretched. So it is very easy to stretch it up. That's why the rubber band has less elasticity. Right? So pencil has more elasticity. The rubber band has less elasticity. Right? That's it. Now let's learn about the compliance. Now the compliance is actually just opposite to the elasticity. So the compliance is actually defined as the ease of being getting stretched. So if an object gets easily stretched up just on pulling, that means the compliance of that is more, like this rubber band. It is so easily stretchable. You can merely pull it up and it will get stretched up. That means this rubber band has more compliance, right? It has less elasticity but has more compliance. This pencil, we apply a lot of forces but doesn't get stretched up. This one has less compliance and more elasticity, right? So the compliance is just opposite to the elasticity. This rubber band has more compliance but less elasticity. Remember this thing. Compliance is just simply the ease of being getting stretched. So any object which is getting easily stretched up has said to be a higher compliance and a less elasticity. Okay, so just remember the compliance of this rubber band is high but the elasticity is less, and opposite is the case for the pencil. Compliance and elasticity are just opposite of each other, just like good is opposite of bad. That's it. So let's try to apply what we just learned. So we learned about the physical meaning of compliance, but how do we fit it into the respiratory system of our body? That's pretty simple. When you inhale the air, your lungs expand, or you can say that your lungs and the chest wall get stretched. Now it gets stretched, and what is that property which comes into that figure? It is the compliance. So whenever you inspire, your lungs get stretched up, there is an increase in volume which decreases the internal pressure, and basically you are able to intake more air in, right? So that stretching during the inspiration is due to the compliance property of the lungs. But when you exhale air, you basically return your lungs to their original position, and that property was possible due to the elasticity. So our lungs has both the property, and even every object does. There is elasticity, there is a compliance. But some objects have high elasticity than the compliance, and some have higher compliances, like the rubber band. The rubber band has higher compliance as compared to elasticity, while the pencil was having more elasticity than the compliance. But that is not the case with the lungs. Our lungs had just the right amount of compliance as well as the elasticity. So for our lungs, the compliance just balances the elasticity. So it means no one takes another one, right? Both are just right amount. Because this is very important to learn, because in several disorders, we will be discussing about them in a little bit of time, like the restrictive lung disorders and the obstructive lung disorders. These are characterized by increase in compliance or increase in elasticity, right? So you must remember that the lungs have right amount of compliance with the right amount of elasticity, because both are required for proper functioning of our lungs. If there would be less compliance, it would be very hard to inspire the air in, because we need to stretch the lungs for taking in the air. And if there is a less amount of elasticity, you will not be able to pull the air out of your lungs, because elasticity is the property that is required to pull back the lungs to their original positions, right? But that was about the compliance of the lungs. But in our respiratory system, when we intake the air or inspire the air, it's not just the lungs which are getting pushed up. It's also the anterior thoracic wall. Yeah, anterior thoracic wall also gets stretched up with the lungs. As we know that the stretching in the lungs is actually indirect, because we don't have muscles in the lungs. The thoracic cavity expands with the lungs. So that means there are two things we need to learn. One is the compliance of the lungs itself, how easily stretchable it is. Another one is the compliance of the anterior thoracic wall, how stretchable the anterior thoracic wall is. We have ribs. As you know, as we inspire the air, the ribs get pulled out. Now that those expulsion of the ribs were surely caused by the muscles, right? But that stretching is actually a property which we know as compliance. So that means there is a compliance for the lungs, there is a compliance for the anterior thoracic wall. So there are two compliances which come into the picture during inspiration in our respiratory system. So as you have learned the physical meaning of the compliance in my previous part, you must now be clear, and I'm asking to you, you tell me which one is supposed to have more compliance. I'm asking, does the lung have the more compliance, or the anterior thoracic wall? It includes ribs, connective tissues, muscles, collectively have more compliance. Which is more compliance? Think of it. Do the lungs have more compliance, or the anterior thoracic wall has more compliance? Go to the meaning, the real physical meaning. Let's find it out together. What was the real physical meaning? The real physical meaning of the compliance was just merely stretchability. If an object is easily stretchable, then you can say it has higher compliance, right? So what do you think? Which is more easily stretchable? Our lungs or the ribs, or I have to say the anterior thoracic wall? Think of it. Can you easily stretch the lungs, or can you easily stretch the ribs? And the answer is obviously the lungs. The lungs are easily stretchable as compared to ribs, because they are bone, and bone is one of the hardest connective tissue in our body. So that means that the lungs has higher compliance as compared to the anterior thoracic wall. This is an important point that every teacher wants his student to remember, and that's why I'm teaching it to you. Many of the students across the globe just note this point down, just remember it for their whole life. But you really need to understand it. And I think that now you are clear that why the lungs have more compliance as compared to the anterior thoracic wall. So that was about the compliance in its two parts. But there is another thing. In our daily life, during inspiration, both the compliance act together. That means in more real life practical conditions, it's actually the summation of both the compliance. When you inhale the air, there is a compliance of lungs, as we have talked about. There is a compliance of the anterior thoracic wall, and both of them combined together work. So in real life, there is nothing like compliance of lungs. There is nothing like compliance of anterior thoracic wall. Actually, there is a summative compliance, right? There is a summation of both of these two compliances, because to actually intake or inhale the air inside the lungs, we need to stretch up the lungs and we need to stretch up the anterior thoracic walls too, right? So in real life, it is actually the summation of both of these two which comes into the play. Now again, let me ask you the question. If I compare the summation of these two compliances with the lungs, right? So I'm asking basically to you that which has more compliance? The lungs has more compliance, or the summative compliance of both of them is more? Think about it. Again, go to the same meaning, the physical meaning of compliance. And the answer is lungs has more compliance. That can mislead that there is a summation of the compliances, so they will add up and that will produce more compliance. Well, it's not the case. Basically think, you have ribs and you have lungs. You have to stretch both of them. And on the another side, you just have the lungs. So which will be more easier to stretch up? Obviously, the lungs alone will be the most easiest to stretch. As compared, you try to stretch the lungs with the ribs. That is kind of a more heavy work to do. That's why the lungs even has more compliance than the combined compliance of our thoracic cavity, right? So that is another important point. Let me just give a brief review what I just talked about. I have talked about the inspiration property, the stretching of the lungs to increase the volume is dependent upon the compliance. The expiration depends on the elasticity of the lungs. And our lungs has just the right amount of compliance with the right amount of elasticity. So no one overtakes another. They are just the right amount. Another thing is that the compliance of the lungs is greater than the compliance of the anterior thoracic wall. There is a summative compliance, that means compliance of lungs plus the compliance of the anterior thoracic wall, which actually exists in real life conditions. And the compliance of lung is even higher than both of these two combined, right? So that was about the compliance and its comparison between another compliances. Now, we will be looking into the pathologies that we can explain with the physical meaning of compliance, like the restrictive and the obstructive respiratory disorder. Let's get into it. So, let's learn about the disease with respect to compliance. Now, when we learn about the disorders of respiration, there are basically two types of disorder. There is restrictive lung disorders and another one is obstructive lung disorders. Right? Let's first learn about the restrictive lung disorders. Now, the word restriction the word restriction is used in relation to entry in something. Remember this name, because sometimes the students are confused between the restriction and obstruction. The word restriction is specifically used in relation to entry in something, while the obstruction is used specifically in relation to exit for something, right? So that is the first thing. Now, so in these disorders, in restrictive lung disorders, there is a problem to the entry of air in the lungs. Or you can say that something is wrong with the inspiration. That means the person is trying to inspire the air, but he's not able to inspire sufficient air to meet his needs. That means in restrictive type of lung disorders, there is something wrong with the inspiration, right? That is the thing that you need to remember your whole of life. Okay. Now, there is a question. The person is facing an issue in inspiration. Why there is an issue in inspiration? If there is a problem in inspiration, so that means that the lungs are not properly expanding or stretching. Because as we know, inspiration is an active process. And when we do the inspiration, our lungs basically expands. The anterior thoracic wall expands. It gets pushed outwards. It gets pushed outward. And that is how we complete the successful inspiration. But the most common reason, if a person is not able to inspire air, comes out to be that the stretching of the lungs or the anterior thoracic wall is not happening properly. So if there is a problem in inspiration, so that means the lungs are not properly expanding or stretching. Now, if the lungs are not properly expanding or unable to expand effectively, then think what could have happened to the compliance. As I have already told you, the real physical meaning of compliance is basically stretchability. More the stretchability is, higher is the compliance. But in restrictive type of lung disorders, there is a problem in expanding, there is a problem in stretching. And if stretching is decreased, so think what could have happened to compliance? And the answer is pretty much simple. As stretchability of the lung is decreased, so is the compliance of the lungs. And that's true. Because the stretchability is decreased and the compliance is directly proportional to the stretchability, so the compliance of the lungs is also decreased. So you need to remember that in restrictive type of lung disorders, the compliance is decreased. Okay, that is the point that needs to be most noticed here. So in restrictive lung disorders like fibrosis, which makes the lungs tissue less stretchable and harden it, it actually decreases the compliance. So disease like fibrosis, they make the tissue of the lungs more hard, right? So they decreases the stretchability. So as the tissue become less stretchable, so is the compliance. Compliance get decreased. Okay, that is the main thing. The relation between the lung disorder and the compliance made it super simple. Now, another thing. Remember, if the compliance of any person is decreased, then most probably he is going to face a problem in inspiration. And there are also real tests based on that. Suppose if I go to a clinic and have my compliance test done, and the reports come out and my compliance of the lungs is decreased. So if my compliance is decreased, then you should be pointing out that I must be definitely feeling problem in inspiration of air. And that is how the compliance actually relates with the real life disorders and conditions. Okay, now let's learn about the obstructive type of lung disorders. Now let's learn about the obstructive type of lung disorders. Now we are already done with the restrictive type of lung disorders, and now we are going to study about the obstructive type of lung disorders. So the word obstruction is used in relation to exit from something. As I already told you that the word restriction is used in relation to entry for something, but the word obstruction is used in relation to exit from something. Okay. So in these disorders, there is a problem to exit pathway of air in the lungs. Or you can say that something is wrong with the expiration. In the restrictive type of lung disorders, we have a problem with the inspiration. The person was unable to inspire the air properly. But in these type, the obstructive type of lung disorders, there is something wrong with the expiration. And we already know that the expiration depends upon the decrease in the volume in the lungs. As the volumes in the lung decreases, the internal pressure gets up and that forces the air out of the lungs, right? If there is a problem in the expiration, so that means the lungs are not properly returning back to their normal position, or you can say that they remain stretched. That's why the expiration is actually impaired. Now think of it. If I say I'm unable to expire the air, what could be the main reason is? You could probably say like there is something wrong with your lungs, buddy. They're not returning back to their original position. Or you can say that they're in their stretched position. When you inspire the air, they get stretched, but they never return to their original position. Right? They remain stretched. That's why the expiration is actually impaired. Because for proper expiration, the lungs need to get back to their original position. If the lungs are unable to return to their original position effectively, then think what could have happened to the compliance. Now think this. The lungs are now in their stretched position. They're not getting back to their original position. And we already know, and I already told you, that expiration is based on the property of elasticity of the lungs. That means the elasticity of the lungs is now decreased. Now, if the elasticity is decreased, the stretchability is increased, what could have happened to the compliance? Think, it is so simple. As the stretchability of the lungs is increased, that's why the lungs are not returning to their original position. Or you can say that elasticity of the lungs is decreased. Okay. So in this case, in the obstructive type of lung disorders, the elasticity of the lungs is decreased. So the compliance of the lungs is actually increased. So in obstructive lung disorders like emphysema or COPDs, like combined obstructive pulmonary diseases, which makes the lung tissue less elastic and easily stretchable, actually increases the compliance. As I already told you that our lungs has just the right amount of compliance and has just the right amount of elasticity. If any one of them get imbalanced, there occurs a disorder. And now you really know, if there is a decrease in elasticity, it causes obstructive lung diseases like emphysema and COPDs. And in these diseases, the lungs remain stretched. The elasticity is decreased. So the compliance is actually increased in those disorders. Okay. And finally, at last, there is a tip for the compliance testings. Remember, if the compliance of any person is increased, then most probably he is going to face a problem in expiration. Let's take the same case. I go to the clinic, have my test done of compliance, report came out, and report says that my compliance for the lungs is actually increased. So if I say to you, my compliance is increased, what does that mean? That means that probably I'm going to face a problem in expirations. And so does the patient of the obstructive lung disorders like emphysema and COPDs does face a problem in the expiration of the air. Okay, so this was the last topic that we have to discuss for this.